Being overweight is a chronic illness, and being overweight predisposes you, causes you, increases your risk of getting a lot of the other illnesses that we were discussing before. A third of the U.S. adults are overweight, and the Centers for Disease Control and Prevention, for Disease Control and Prevention. Obesity rates increased steadily throughout the U.S. Increased over the last 20 years in all age groups. And obesity increases the risk, as I said, of other illnesses and causing other illnesses. And if you have other illnesses, also can increase the risk of them being worse or getting worse. Screening for obesity is part of your annual physical exam, as I mentioned before. It's a ratio between your height and your weight, and that you would discuss with your healthcare provider. So your weight in pounds, that's the formula that we use to calculate it. And a BMI of less than 18 is actually underweight. A body mass index, BMI, between 18.5 and 24.9 is normal, considered normal. And anything over that is overweight to being obese. And being obese, as I said, predisposes you for so many other illnesses, including arthritis, because of the increased pressure and weight on your joints. The skin is the largest organ on the body. It is actually an organ. In adults, in an average adult, it's approximately 8 pounds. And skin is at risk of developing its own illnesses, and the number one is skin cancer. The ones that are preventable is skin cancer, and skin cancer is called melanoma, and there's different kinds of melanoma. There's basal and squamous cell carcinoma, which can develop into skin cancer. That's carcinoma, and occurs more commonly in males. But that being said, that it occurs more in males, does that mean women are safe and should not take precautions? High-risk persons for getting skin cancer are persons with fair complexion. If you regularly use an indoor tanning bed or go for tanning at a salon, a history of sunburns, if you've ever had a sunburn, that increases your risk of having skin cancer later on. And the risk factors are what you usually see that you definitely should discuss with your healthcare provider is what's called an atypical mole. So it's not usually, if you've had moles your whole life, it's also recommended that you have regular follow-up visits with a dermatologist, and they will map your moles to make sure. So when you come into care, they map your moles. So this is what you came into care with, and at this point in time, you're free of cancer. And then they will follow those moles annually to see if they're changing in size, changing in color, changing in shape, because any of those would indicate that that mole may be developing and becoming cancerous. Having multiple moles, again, they're called nevi. That's, again, follow up with your dermatologist. Or if you've had a personal history, so anyone in your family that's had skin cancer increases your risk of actually getting skin cancer. Prevention for having skin cancer is to avoid direct sun exposure between 10 a.m. and 4 p.m. That's when the sun is at its brightest and hottest. And definitely wear a hat when you're outside. If you're going outside, not only at the beach, definitely wear a sunscreen. And the higher the SPF, you look on the bottle, if the SPF is higher, 15 or over, I think is up to 20 or over, the higher the SPF is, the better protection that you have. And if you are at the beach, once you go into the water, that sunscreen that you put on gets washed off, so you have to reapply. So it's not like you put it on one time for the day and you're protected. If you're going into the water, then definitely when you come back out, you need to reapply it again. And also, your dermatologist or your primary care will also advise you, if you are at a higher risk of getting skin cancer, how to perform a self-exam for yourself at home. So if you see anything doing your self-exam, then definitely follow up with your healthcare provider.